All right, good afternoon, everyone, and welcome to today's webinar, Advancing Equity for All Racial Groups Through the Governmental Use of Racial Equity Tools. I'm Daniel Wacker. I'm the Program Development Associate here at the Network for Public Health Law, and I will be your host for today's webinar. We strongly encourage attendee Q&A interactions with the Q&A function down below. So if you click at the bottom of your screen, you'll see a Q&A button, and if you submit questions there, our panelists will answer them at the end of the webinar. And so once you click on that, you can type in a question and it'll be held there until it is answered. So then your moderator for today's webinar is Dawn Hunter, the Director of the Southeastern Region for the Network for Public Health Law, and I'll pass it over to her for introductions of our panelists and to begin the webinar. Dawn, to you.
Thanks, Daniel, and hi, everyone. I'm so glad to be here today. We have a really exciting lineup and a topic that I'm personally very excited to bring to you all today. My team at the network focuses on racial health equity, and a lot of our work stemmed from in early 2020, mid-2020, an analysis of declarations of racism as a public health crisis. And from that work, we co-founded the Collaborative for Anti-Racism and Equity, along with Professor Ruqayyah Yearby, who is one of our speakers today. And one of the questions that we've learned about that work over time is the question that we get most often is, how do we do racial equity and anti-racism work? What tools and practical resources are out there? So this webinar was put together by our team in an effort to help answer that question. So I'm not going to talk long because we have so many great presentations today. I just want to remind you, I will be monitoring the Q&A. Please put your questions there. We'll come back to them at the end. And we're going to start with, I think, go to the next slide, Professor Ruqayyah Yearby, who is the inaugural Kara J. Trott Professor in Law at the Moritz College of Law and a faculty affiliate of the Kirwan Institute at The Ohio State University. Go Buckeyes. And she is also co-founder and a faculty affiliate of St. Louis University's Institute for Healing Justice and Equity, and one of the co-founders of the Collaborative for Anti-Racism and Equity, as I mentioned. So Ruqayyah, I will turn it over to you.
Thank you. Thank you for having me. And I also want to say thank you to my colleague, Crystal Lewis, who couldn't join us today because she has COVID. Next slide. So the work that we have done together, my team and I, including Sydney Watson, Keon Gilbert, Kitty Stamatakis, and Sharice Gibson, was a report on the governmental use of racial equity tools to address systemic racism and the social determinants of health. This work was funded by the Robert Wood Johnson Foundation. And before I get into a discussion of the work, I just want to briefly define what racial equity tools can include. So that includes training, materials, toolkits, data indicators, and frameworks that guide leaders, employees, and community members in working to address racial equity. The focus of our report was on the use of racial equity tools to address systemic racism and the social determinants of health. We did this by analyzing laws, and I'm going to talk about why laws are so important in a second. We also analyzed surveys that we sent out to local jurisdictions using racial equity tools, and then followed up with 3 individual jurisdictions to talk about their specific work, including King County, Seattle, Washington, and Philadelphia, Pennsylvania. So I do want to highlight the key, which is that legal and policy decisions shape the way people experience life every day. While they can bolster the conditions for people to thrive, they can also create and perpetuate inequities in health, economic, and social outcomes. We use an evaluation of laws and policies to understand the impacts on different racial groups' health outcomes. We believe that law and policy can be a key strategy to advancing equal opportunity and addressing inequities in health outcomes, particularly the use of racial equity tools to measure, identify differences in access to social determinants of health, including housing, education, and employment, and try to identify ways that local jurisdictions can can fulfill their constitutional and state mandates to treat everyone equally and ensure that everyone, especially racial and ethnic minorities who are often disproportionately harmed, are treated fairly. Next slide. So in our review, we focused on the ways that systemic racism can limit can limit racial and ethnic minorities' equal access to economic stability, which includes employment, housing, access to healthcare, childhood education, as well as civic participation. We pulled laws from 4 of these areas. So we looked at laws related to increases in minimum wage. We looked at housing, fair housing and zoning laws around affordable housing. We also looked at education, particularly access to preschool education, and then looked at access to paid leave, which is tied to increased or decreased access to health care, and tried to track that to see if it was connected with local jurisdictions' use of racial equity tools, meaning did they look at these policies to try to address inequities by race. As you can see on the left, systemic racism is defined as a complex array of social structures, governmental policies, institutional practices, and interpersonal interactions. And we pull this from David Williams' definition. We know that systemic racism not only results in poor health outcomes for all racial groups, but disproportionately racial and ethnic minorities. It also saps the strength of the whole society through the waste of human resources. Next slide. And racial equity tools allow us the opportunity to begin to address some of these issues. And why we say that is because racial equity tools allow local jurisdictions to begin to interrogate what are their policies and the structures of government that can lead to an equitable access to employment, fair housing, healthcare, education. And as the research has shown, this has been associated with health inequities. But the government has an opportunity using racial equity tools not to just address systemic racism, but also look within the particular aspects of the social determinants of health that impact people's lives. We put a couple of examples from King County. The county used racial equity tools to develop a shared vision of the unhealthy stream that creates inequities and the healthy streams that creates equity to guide their work. And I will put in a link to that website so you can see their vision and their tool. One of the things they told us is that they use racial equity tools to review budget decisions and to ensure that they are investing in a way that is equitable, right? And so they're shifting away from systems that cause harm and that prevent equal access to some of the social determinants of health, education, housing, and then use that as a way to take that money and to invest in things that will improve people's health. Next slide. You can hear right now what I am focused on is that it's not just about the work that is done to and within the community, it's also about the work that needs to be done within government. And so one of the things that we notice is that many of the local jurisdictions that were making headway to achieve racial equity did and use the racial equity tools for internal work to look at their organizational systems and structures that were impacting the community. Next slide. And so we came up with a diagram that shows what we believe is the best process of using racial equity tools, which includes starting from strategic planning, going to training, right? Using a racial equity tool to decide what are the aspects that you're going to focus on internally and externally, using that to train people on changes that need to be made, implementing that strategic plan and those changes, which can result in workplace changes, not just in terms of external connections with community, but it also can result in changes in employment, hiring, as well as staffing. We really focused on in our projects. Furthermore, how is this connected to law and policy change, particularly around affordable housing, around spending for pre-K, and minimum wage and paid sick leave? One of the things that I want to highlight in this slide, and I'll highlight it more so in the next slide, is that a part of the law and policy change, we always need to go back to evaluate what is good, what is not effective, and then use that process to continue on to their next strategic plan. Next slide. And so just wrapping up, what we found in terms of examples of successful racial equity strategies was the use of racial equity tools for internal change, around creating conditions under which employees can succeed in their work and their lives, providing professional development, as well as showing appreciation for employees, transforming the hiring process, which means removing barriers that prevent a diverse pool of applicants and hires by prohibiting the use of referrals, replacing written assessments with oral assessments. We saw in one jurisdiction that actually impacted who was at the top of the hiring pool. Changing budget allocation processes, developing positions, departments, and offices specific to the implementation of racial equity tools and strategies, even though you should also integrate that within all of the departments within the government. And finally, evaluating the impact of the changes must be done throughout the entire process and not just as an afterthought. So with that, I want to thank you and I look forward to your questions.
Thank you. And actually, Rukai, if I could ask you a quick question that I think you can answer, and since it's directly relevant, in the Q&A we had, implementation is before workplace change, right?
It is. We needed to move that up a little bit on the circle. So yes, it goes from strategic planning. If you go back one slide or a couple of slides, just to the model. Yes, right there. So it goes from strategic planning, training, and implementation should be a little bit up. And then it goes from implementation to workplace change, law and policy change, and back to evaluation. So yes, thank you.
Thank you for answering that question. I personally love this report. I cite to it often. One of the things I like to, my takeaways from it, which you shared, is we have to make sure that our own house is in order before we go out and try to influence change in the communities that we serve. So thank you for sharing that. And we are going to move into the next presentation, which is the first tool that we're sharing today. And our presenter is Phyllis Jaden, who is a senior attorney with my team in the Southeastern region at the network, who started with us in February in this year and has brought such great energy and insights to the team. Phyllis has worked as a nonprofit attorney for several years and led the development of the micro toolkit equity assessment framework for public health laws and policies that we are launching and sharing here today. So Phyllis, I will turn it over to you.
Thanks, Dawn and Rakaya. So thank you for being here, everyone. My name again, it's Phyllis Jaden. I work with the Southeastern region with Dawn, where we do focus on health equity, and we are excited to launch our micro toolkit today. If you could please go to the next slide. So the micro toolkit came out of an equity assessment framework that was done before my time with the network by the Network for Public Health Law's Health Equity Work Group. That's a partnership of staff across the network's different regions. So the original framework was 2 pages. It gave a succinct and easy to follow framework for an equity assessment. Our team decided to take that framework and make it more visually appealing and something that's easier to use for the work that your teams will be doing. It's a great start to an assessment. Several staff members contributed to the creation of this toolkit, which is essentially a set of worksheets. It's a step-by-step fill-in-the-blank process that it guides you through, and it's created for both local governments and community-based organizations to assess equity and discover opportunities to improve policy. So it provides 6 clear steps with instructions, and that will guide you and your team through a good start to an equity assessment. You can go to the next slide, please. So as we know, toolkits can often be lengthy and sometimes make entities wary of the time and resources that they will demand. Of course, make no mistake, there is no shortcut to equity. It's difficult work. It demands resource allocation. With that said, the micro toolkit is an out-of-the-box tool that can be used without in-depth training and with limited use of your already limited resources. The micro toolkit is made for policymakers and partners who lead, shape, or influence policy, and helps guide discussion around how equity is considered. It's easy, it's accessible, and can be practically applied. So we'll go over the toolkit for a few minutes. And as we do, please keep in mind, this is meant to be a living document. We look forward to your application of the tool so that we can continue to make it better. Next slide, please. So we'll go over the 6 steps first very quickly. So the first step is to establish why the policy is being considered. The second step asks you to explain the context of the policy. The third step asks that you determine the impact of your policy on both external and internal partners. Next, please. So the fourth step asks you to identify those potential outcomes of the policy. Step 5 asks that you consider other potential policy pathways. And step 6 asks you to consider how your policy will be sustainable. And for purposes of the toolkit, a policy can mean a statute, a regulation, an ordinance, an executive order, an organizational policy, formal guidance, or other. And so let's go ahead and take a peek at the toolkit. Next slide, please. So again, this is a new toolkit. We don't have any examples to share with you, so we came up with a sort of high-level generalized example. Your own application will, of course, have more detail, but we want to give you an idea of how the toolkit would work. So our example that we will share with you today is a state bill that seeks a state policy amendment for a Medicaid-covered doula services. So, or excuse me, a state plan amendment. So the description, or forgive me, step 1 would be establishing why the policy is being reviewed or proposed. The description, of course, would be a bill seeking a state plan amendment for pregnant beneficiaries to receive doula services under a state Medicaid plan. And the issue, of course, being that the United States has a high maternal mortality rate, and the lower income an individual is, the higher that risk is. And mothers who are Black have the highest risk. Doulas are known to improve those health outcomes. What you can't see here, because it's only a snapshot of step 1, is we ask that you engage different perspectives. And for our example, we could include organizations that serve pregnant and birthing people in communities of color in the state. Next slide, please. So step 2 provides an opportunity to provide more context and information on data related to the policy. For our SPA doulas example, of course, the interest in creating it would be to address the high rate of maternal mortality among low-income persons, and especially communities of color in the state. We ask that you consider, does your policy have any existing support or opposition? And that you describe or summarize the data related to your policy. For our example, there is a lot of data, of course, on the high rate of maternal mortality, as well as the positive impact of doulas for those outcomes. Also, please note the checklist regarding whether your data is complete, reliable, and unbiased. For more information on bias and data, please see the link to the Do No Harm Guide from the Urban Institute. And if you need some assistance in your data assessment, the Mid-States region of the Network for Public Health, it specializes in data, and they'd be happy to help you. Please reach out. Next slide, please. So step 3 of the toolkit focuses on the policy impact and whether that policy will impact internal, external partners, or both. For our state doula, or excuse me, SPA doula example, state health department may consider the impact of costs of improved health and the burden of implementing the policy. And of course, you consider external partners. For example, organizations that serve expectant mothers in the state who are Black, who will be impacted by this policy. For external partners, you're also going to want to consider ways to engage them. That's, again, not shown here in this just snapshot of step 3. Also not shown here is a statement stating that final decision should be communicated clearly to all partners, and it should be clear on whether the feedback impacted the final policy decision. Next slide, please. So Appendix A to the micro toolkit, this is a supplement to step 3. This is for external partners who may be impacted. It gives you space to identify groups, note input, and other considerations, including who on your team is responsible for reaching out to these external partners. For our spa doula example, we identified organizations serving expectant mothers who are Black as a possible external partner, but input from several community groups should be collected. Appendix A helps guide your discussion in a meaningful way. And as Don mentioned earlier, in the Southeastern region, we focus a lot on the declarations of racism as a public health crisis. And one theme among these declarations is encouraging meaningful communication with communities of color. Appendix A can help you with that dialogue. If you could please move to the next slide. Appendix B is also referenced under step 3. So this is a worksheet specifically for community-based organizations. Community-based organizations can use the micro toolkit themselves and go through it and find it helpful. However, with stretched time and resources, we wanted to create a worksheet that was specifically for more in-depth and focused input from community-based organizations. And again, through our work, we have found that community-based organizations are in need of tools to help facilitate this participation in policy discussion. So Appendix B can help with that. Next slide, please. Step 4 focuses on the potential outcomes from the policy being considered and how it may impact the status quo. There may be an obvious desired effect for a policy to improve health outcomes, but the space also allows for opportunities to consider how could it potentially worsen or have no impact on the status quo. For our doula spa example, the desired outcome is, of course, to improve maternal health outcomes for those with less resources. Though the analysis that we ask you to do here is small, and a true and thorough analysis, of course, would take more time, it's for this reason the micro toolkit asks that your team at least start considering the more obvious outcomes, and we hope that this will lead to further discussion. In our example, the spa doula policy has, of course, been implemented in several states. What you can't see in this snapshot is there is an area to consider lessons that were learned by others who enacted a similar or the same policy. Next slide, please. So step 5 asks you to consider other policy pathways. Are there better options to achieve your desired outcome? And you might find in your assessment that more than one policy intervention is necessary. For our spa doula example, the state may consider approving additional doula training programs to aid the success of implementation of the spa doula policy. Another example could be an organizational policy, a change in hospital policy that allows birth parents to choose their care team. Next step, please. Now, finally, step 6. Step 6 asks you to consider how to make your policy sustainable. For example, our spa doula program may need to be reviewed on an annual basis to make certain there's enough trained doulas in the state to meet the need, among other issues to review. Step 6 also asks that you consider the conditions necessary for success and those that may already be in place. You may already have bipartisan support, for example, for the spa doula policy. Next slide, please. So last, the micro toolkit includes a checklist to make certain that your team has considered all the steps carefully. Again, should your team complete this assessment with the micro toolkit and you wish to delve further into a policy assessment, please do contact the Network for Public Health Law. We're very happy to assist you in those next steps. And again, as your team uses the micro toolkit, we welcome your feedback. We'd like to improve the tool and make it better as it's applied. Next slide, please. So thank you for your time. Again, if you would like any assistance, please reach out to the Network for Public Health Law. My email address is on the screen, and I look forward to your questions.
Thank you, Phyllis, for sharing the micro toolkit for attendees. The micro toolkit is linked in the chat. The Do No Harm Guide, someone asked where that is. That is linked on page 5 of the toolkit. It is a fillable PDF, so it's designed to help you, just to make it easier for you to fill it out, but I think you can also print it and write on it. So we wanted to make it very accessible. All right, thanks. And we will move on to the next presentation. Next up, and I think next slide, Daniel, yes. We have Jeanette Raymond. Jeanette has over 25 years of experience in advancing health equity and authentic community engagement through public health practice, and is currently the Assistant Director for the Center for Public Health Practice at the Minnesota Department of Health. Her experience includes advancing the health equity data analysis process, or HEDA process, which supported local public health departments to conduct qualitative research and share the results with their communities. We're real excited to hear about this tool. Jeanette, I will turn it over to you.
Great, thanks, and thanks for having me. You can go to the next slide. So I'm going to be talking about conducting this health equity data analysis at a local level, sort of how we developed the process and how it was used by local public health departments. Just a note, I'll be referring to it as the HEDA, so I don't have to say that whole long stretch of words. So next slide. I wanted to put a little bit of context about how this came out. I work for the Minnesota Department of Health. And in 2013, there was a Center for Health Equity established at the Minnesota Department of Health. The two people who were the initial authors of this worked within that department and helped, when they first started, they were really looking at quantitative data related to health disparities, and they supported local public health to find and use those data in assessments and other tools. In 2014, then we released an Advancing Health Equity in Minnesota report to the legislature. This report was one of the first ones that really named governmental documents that named structural racism and called on public health departments to be explicit about race and racism. So this report sort of jump-started a lot of the health equity, a variety of health equity work at the Department of Health. So then in 2015, we released the HEDA guide, and it originated out of a presentation to local public health departments about how they could look at their data and elevate where inequities were indicated, and then what to do with that. And we really realized a lot of our quantitative data did not dig into the why of racial and health inequities. So we developed this more qualitative data approach. And we piloted the HEDA framework then in 2016 to 2018 with local public health agencies. I think one of the sort of policy things is that it became a required part of one of our grants. And I think there's a lot of health equity tools, I'll reiterate this at the end, that are there for people to use, but the requirement made it really, they had to do it. So next slide. I just wanted to sort of pull out one of the things from the Advancing Health Equity report. The recommendation was to assure that health equity and the analysis of structural inequities, including structural racism, become integral aspects of all MDH divisions and programs. And while we have not achieved that, even in all these years, I think the HEDA was one attempt to move that forward. Next slide. So the HEDA was really designed to change how one approaches, or how our local public health departments were approaching data analysis. So we wanted to, it was based in research that health is created by multiple conditions, not just healthcare, behavior, or genetics. And these are what we refer to as the social determinants of health. I like to refer them to as key conditions so that others other than public health experts can understand the jargon. Community members are partners throughout the HEDA, so they're important in identifying disparities and then sharing with us why being in that population, why is it that these disparities exist? What are the causes and conditions? It uses qualitative and quantitative data to describe health barriers and the health of populations. And in our case, it was really at the local level with specific communities, so we could dig a little bit deeper. Next slide. So, disparities questions, I think our understanding, public health understanding around health equity data and health inequity data has changed. So we used to ask, what is the obesity rate and what groups have higher rates of obesity? And we sort of stopped there. And then we would go on to our solutions. But a health and racial equity direction really asks, why do these groups have higher rates? What are the conditions that create the differences in obesity between populations? And what are the causes that create those conditions? And really, is structural racism one of those causes? Okay, next slide. The process that we ask people to go through is to, there's sort of 2 rounds of connection, population, and differences. So the connection is really understanding what is the literature saying about the connection. First, let me just back up. First, we would have a local public health department identify a measurable health inequity. So diabetes rates by income, smoking rates by education. So it was linked to a measurable structural health inequity. We worked with our local public health department then to understand what is the connection between income and diabetes by looking at the literature. And then so that they would get a fuller understanding of what that was. Then in the next phase, we would actually collect qualitative data around what are the conditions and causes that are leading to that difference, and then re-look at that literature again to sort of see what the community was saying, what the literature was saying to create a fuller understanding. And through this whole process, it's really important to engage community. Obviously, in the qualitative data collection, there is community engagement, but communities can also help us frame the questions that we want to ask. I want to note that we had challenges in Minnesota around race data because some of our populations and some of our jurisdictions were so small that it was difficult to elevate racial inequities. And what locals would do is, if they saw a difference in, for instance, diabetes rates among the elderly, they might focus on a racial population to elevate the causes and conditions for that population. So in one county, for instance, they worked with Somali elders to figure out what were those causes and conditions. Next slide. So we have our stories about what creates health, and public health has its areas of expertise. And so when we sort of think about our past approach, we might look at risk factors like overweight, age 45, et cetera. And then our conventional solutions might be free healthy foods classes, how to cook foods, free exercise programs, medical reminders via text for those with diabetes. And then our intended outcomes were eating less, more healthful, being more physically active, managing diabetes. But we really weren't getting down to those key conditions or social determinants of health. There's more to the story. And so the HEDA was trying to get to what is more in the story. Next slide. So this picture on the right, basically how do you get the rest of the story? We had to get people out of their offices and into the community. And that's just sort of these slides are sort of indicate where we might find people, at schools, in farm countries, in community gatherings. So it's like, get out and into the community, because public health professionals cannot do it by sitting at their desks. Next slide. So in the condition steps, the idea is to identify social, economic, and environmental conditions that create health differences. And some of these that people might look at were mentioned in the first presentation: housing, employment, income, social exclusion, air quality, minimum wage, access to paid leave. So first of all, we need to describe some of those and then look at the underlying causes steps. Our local public health staff work with community members to identify the causes of those differences in living and working conditions, such as laws, organizational policies, and community norms. The key to the success of this is to engage community members to find out from their perspective what barriers exist. Next slide. So part of the qualitative data collection was who, and I think the primary message that I want to get across here is that people are experts in their own lives and know the causes and know solutions to these issues. So many of our local public health organizations had good relationships with community members and spoke to them often, but most of this was sort of in a service provider client relationship. And I think one of the things that's important with the HEDA process is to understand the power dynamics between who is hosting the qualitative data collection opportunities and what is the relationship to the people that they're collecting from, and sort of being careful about that power dynamic. At times, our public health staff did not have existing relationships with people in the populations they identified. In these situations, they considered their bridging relationships. People in their department, on an advisory committee, or community leaders who might be able to facilitate an introduction to community members. For instance, one of our local health departments partnered with a community health worker employed at their healthcare clinic to connect with their Latino community members. Another local health department partnered with the American Indian Community College, meeting with both staff and students. So relationship building is really important, and often we don't have the relationships we need. Next step. Next slide, sorry. So the kind of qualitative, I would say these were not academic level qualitative data collection and analysis. These were more of a community level and not gathering enough information with enough people to really inform policy and practice. And it was done in a wide variety of ways: focus groups, policy reviews, key informant interviews, pop-up engagement like being at the WIC clinic and meeting with WIC clients there. World Cafe is a particular kind of facilitation that engages people in looking at problems. Root cause analysis, fishbone analysis, intercept interview. So there were a lot of different forms that people use to engage with folks around the conditions and causes. Again, it's important to ask, I think in that slide around about who we hire, do we have the people that we need in our agencies? It's important to consider who is asking the question. Do you have diverse staff that reflects the community? Again, what is the power relationship between the staff and community member? How might these things affect the opportunity to gather accurate and comprehensive qualitative data and the ability to assess its meaning in the convention in the context of community culture? So it is a question, do we have the right people asking the questions? We may or may not have had those in the past. Next slide. So one of the challenges in doing this process is the challenge of the predominant health narrative. And the Minnesota Department of Health has done a lot of work on health narratives and health equity narratives. I don't have a lot of time to go into it, but the predominant narrative about health is that people are responsible for their individual health, and or access to healthcare is really important. And while these things are important, they get in the way of people thinking about these root causes and root conditions. And so as people did this process, they found out that people would say, I'm too tired, it's in my genes, I don't eat right. Our public health and healthcare professionals would say, well, why don't they just exercise? If she had just come in for the prenatal care in the first trimester, without getting to the 5 whys underneath those things. So that was a challenge for us in supporting local public health departments to do this, but it was also a challenge as they talked with people from communities who are very well versed in the, it's the water that we swim in, this predominant narrative. I think thing I forgot to mention is that we had about a 6-person team at MDH supporting local public health departments through this process, both the identification of their quantitative data, the quality and connecting them with the literature and resources, the qualitative, and then the qualitative data collection process and analysis, and then also community engagement support. So it was a big lift for them, but we tried to provide a lot of support. Okay, let me just move on to sort of the so what. Next slide. So I'm not going to spend time. This is sort of the conventional solutions based on quantitative data and our public health expertise. Next slide. But when we actually looked at some of the underlying conditions and causes, it lifted up different things like stress, culture, time, language barriers. You can read these: inflexible work schedule, job opportunities, underrepresentation of folks in decision-making processes, and unexamined structural racism reflected institutional policies and practices. And then you couple that with risk factors, and you may still use some of your conventional solutions, but it also leads to other ideas: EBT at farmers markets, culturally appropriate food and senior center programs, increased minimum wage. And then hopefully through addressing those things, that leads to these intended outcomes as well. Next slide. So just to wrap up, this process was, I want to say it was a process at a point in time. It might look different now. It did expand the capacity and understanding of local public health departments around health equity and the multiple conditions of health. It did lead to more of a sense of accountability to communities most impacted by health inequities, including racial communities. And it also increased the, maybe it was a stepping stone to a little bit more trust between local communities and local public health departments, if people could see some small improvements in organizational practices and policies in the short term. It can lead to better aligned programs and processes, and then it also is there to support more equitable policies. So next slide. I think one of the biggest things is the change in mental models for our local public health departments. Some of them are continuing to use this tool because it was so powerful in having them think about how their agency interacts with their community. Next slide. I think that, 3 thoughts. Requiring versus opt-in. I mentioned this before, but if you have a tool and you have the power to require it, it's better than just having people opt in. And again, not everybody completed the HEDA at this really high level, but it really got a conversation started. We have evolving understanding of these tools, and we need to revise these tools as we move on. And one of the revisions we really want to consider in this, if we move forward with the HEDA, is one that reflects more explicitly structural racism and addressing structural racism in our programs and policies. And the final thing is there's the power of the predominant narrative and status quo. Even once you have a cohort of people that has learned to use a tool and is committed to it, people move on. And the new people that come in, our public health institutions are not necessarily training people on equity and And so it just sort of sucks us right back into how things are, quote, normally done. So I think that's it.
Thank you, Jeanette. I want to ask you one quick follow-up question from the chat,
Yeah.
or from the Q&A, I should say, which is it possible to fit why not into HEDA? For example, why is obesity not common in certain groups or populations? And I'm guessing this person is thinking about protective factors. What are your thoughts on that?
Yeah, well, two things. This is one of the evolutions, right? And I'm working with a group of people on our next statewide health assessment, and we're really trying to lean into assets and strengths of communities. Like, what about that bolsters people's resilience or communities' resilience? It's a really good point. I once was talking to a doctor and he said, well, I'm not affected by the social determinants of health. And it was like, oh, yes, you are. You have a really high education, you have a high income, you're white, you have a lot of power in your sense of agency and power. So it is a really good point to have the why not. So both building on strengths and assets of communities, but also acknowledging that there are, yeah. So I hope that's a cogent answer.
Yes, thank you. And we can get more into that in the Q&A as well. But now I want to go to the last tool that we're sharing today. Bukta Gaysar is the Senior Director of the Office of Equity, Diversion, and Inclusion, where she provides leadership and strategic direction for the Port's equity, diversity, and inclusion efforts, both internal and external. And she's here to talk about the equity and budgeting playbook. There was a question in the Q&A about budgeting, so I'm sure this is going to be super interesting to several folks. Bukta, over to you.
Thank you, Dawn. Good afternoon, everyone. Bukta Gaysar, she, her pronouns. As you've just heard, I live in Seattle, where you've just heard from a lot of the presentations. The city of Seattle was the first government in the country to implement a racial equity toolkit, and also then Martin Luther King County, where the city of Seattle is within, has done an incredible amount of work. And I work at the Port of Seattle, so I'll be talking a little bit about our work. I sort of understand from all of the presentations that we're a little bit different, but the work is actually really overlapping with a lot of what you've just heard. But as a governmental entity, we're a little bit different than the other presentations today. But I want to thank all the other panelists for their incredible work and their presentations. And really glad to be with all of you here today. So let's go to the next slide. I'm just going to take a minute to talk with you about first who we are as a port, and then talk about our budgeting work. Next slide, please. So the Port of Seattle is a standalone government. We are not a part of the city or the county. In that way, the Port of Seattle is actually very unique. There are only a handful of ports in the country that are special purpose governments, where all of our 5 commissioners are elected. And we are 111 years old, and we have statutory powers to raise taxes, develop and operate and maintain public facilities. Next slide, please. Just a quick overview of what we're all about. On the left, you see the Port of Seattle. Voters in Martin Luther King County elect our 5 commissioners, and we oversee the Seattle SeaTac Airport, our cruise terminals, marinas, commercial fishing, environmental programs, and also our real estate. We're a $1 billion organization. And we also have a joint partnership with the Port of Tacoma, who have their own elected commissioners. And together we have the Northwest Seaport Alliance and operate all the maritime cargo. So you can see that the scope of our work is tremendous, and the budget is pretty powerful, and the economic impact and the engine behind this in King County is huge. Next slide, please. So I joined the Port of Seattle just 4 years ago I came from King County, where you've just heard in the presentations before me, a number of people refer to King County's Office of Equity and Social Justice. That's where I worked. And their social determinants of health and racism as a public health a threat that has been a really critical tool in King County. I came from the county to the Port of Seattle as the first employee of the office to create the Office of Equity for the port. And this is how the port decided to create the office, that it is actually a horizontal line running across all of our businesses. And this is one of the things that actually convinced me that I would have a chance to succeed at the port, because often what you see in offices of equity is that they are actually not horizontally running across, but actually a standalone entity that is ironically often marginalized and has very little voice, very little power at the decision-making tables. And the Office of Equity or individuals having equity roles are often not in the room when critical decisions are being discussed or made. And so I am one of the 12 executive leadership team members at the Port of Seattle. And really these two factors, my role and how it was designed and this graphic that you see here, were the two things that I thought were most appealing about the job, as well as being the first and kind of getting it up and running from the ground up. All right. Next slide, please. So, as I said, because we're 4 years old, a lot of our work is rather new. And because I've worked with City of Seattle and King County, and I'm really familiar with all of the racial equity toolkits and practices and analysis of policies, I've kind of modeled some of our work from the two entities, but also kind of in new innovations in our work, and budgeting is one of them that you're going to hear about. But in the last 4 years, we have done a lot of focus groups and interviews internally in our organization and also with external stakeholders. And based on that, we have a strategic plan that is broadly based on these 3 strategies to transform the port internally by infusing racial equity principle in everything, in our principles, practices, and in all aspects of the organization, in our structure, programs, policies, and processes. This is a tremendous goal. As you've heard from our other panelists, and all of you who do equity work know that often equity work is very much transactionally focused, and we are focusing our work on transformational aspects of racial equity and really cultural transformation of the entire organization. And then the second strategy has to do with tangible and equitable benefits for our communities that are impacted by the port's operations. And then the third is really to be in connection with and in relationship with others who are doing this work around the country, and to always be looking at innovations and to be learning and sharing our work. So we do a lot of different kind of things around strategy 1, but the rest of my comments really focus on our budgeting work. Next slide, please. Okay, so when I came to the port 4 years ago, I decided that I wanted to try this budgeting with the equity lens and framework. However, because we are a special purpose government, this has been very, very challenging. I think that for cities or counties or other institutions that are general purpose and there are more flexibility, this might be an easier task. But for us, this is now the third, we're going to enter the 4th year next year of our budgeting, and we've done this in very different ways. We started out with the first couple of years with basically building a racial equity toolkit and asking everyone in their process to engage in a conversation about equity and to incorporate equity where it was possible. That actually wasn't enough. So we've attempted to go further this year. And so you're going to be hearing about our newest kind of version of this work. We have just released a equity in budgeting playbook for all of our entire organization. And this is a tool that everyone is using currently right now. We're in the process of doing our budgeting work for next year. So everyone is using that in discussion, in sort of reflection to be able to do their budgeting. So next slide, please. I'm going to talk about how we are going about doing this work for next year. We really see our, we talk about our budget as a document that, of course, does what it's supposed to do, the financial aspects of how we operate, but also really articulates and holds our values of accountability and transparency. So we, really referring to our budget as a moral document that speaks about who we are and needs to back our commitment to racial equity has been a tremendous shift in itself. That in itself of like talking about this needs to reinforce and back up our commitment to racial equity. And that's not just about my office and backing up our office with resources, but that it really needs to be reflected in the entire organization. So we're now asking, you saw in the slide about the main divisions in the organization, aviation, maritime, economic development, and corporate. We're now asking all of those divisions to track their equity spending and to report that publicly. So this is really a shift because we've gone from saying, do your budgeting democratically, address the questions in the toolkit, get everyone around the table, talk about issues, to now saying, we're going to have an equity spending tool. It's called Equity Spending and Accountability Project. We probably could have a more creative name. This is kind of the very tactical kind of ESAP is the tool. But we're going to really report that out publicly. So next slide, please. So of course, our first task was to say, and I think a couple of speakers talked about this, what legal and policy decisions could back this up. So we, as I mentioned earlier, have 5 commissioners, and we passed the equity policy directive that passed guidance around this. A part of why I really wanted this in policy is that, our employees regularly say, how could this work remain sustainable? How do we make sure that it's not just the support of the current 5 commissioners and our CEO and Bukta, but also like lives beyond all of us? And that's really the intent behind having a policy directive that actually codifies equity into the life of the organization. So the equity policy directive directed us to go back to find a definition for equity spending and to do an audit of the last 5 years. So as you can imagine, this was tremendously challenging because we had to look back in the last 5 years and then to report it out publicly. Okay, next slide, please. I'm talking as fast as possible, so I hope that what I'm saying makes sense. But all right, so at the division level, here's the 3 bullet points that you see at the bottom of this slide is where we finally landed on defining equity spending. We said, and this is partly again because of how challenging it is to actually define equity in our spending. Because just an example of this is that at the Port of Seattle, of course, we do a tremendous amount of environmental mitigation and environmental spending. And so, for example, our environmental team would say, oh, we're cleaning up the entire Duwamish River, and this will positively impact communities of color. So that is entirely equity spending because everybody's lives will be better, including communities of color. But as an equity practitioner, I really believe that we have to think about what is actually targeted and specifically designed to impact communities of color. So I hope that makes sense to you, that that is how I really focus on distinguishing spending from equity spending. Was it specifically targeted to improve employees of color's lives or people of color's lives in our community? So these three definitions: invest directly in structurally excluded communities, either through grants, contracts, programs, or dedicated facilities; invest in businesses and individuals outside of the port to help us realize our equity priorities; invest in port employees whose essential functions were designed to primarily focus on advancing equity work. This was a challenging one because everyone, people have feelings, of course, and they really felt like they wanted the work to be counted, because on the one hand, I'm saying equity needs to be infused in everyone's work. So as a researcher, as a data analyst, as a budget person, you need to infuse equity. So they would say, okay, well, then everyone's salary needs to be counted as equity spending. But again, I really wanted to distinguish people in people's minds and do a lot of teaching and raising awareness about this in the organization, that what is specifically targeted is very different than generally spending with the equity in mind. Okay, next slide, please. So we ask every division to use those three definitions, and you'll see some examples of that, to pull out their equity spending that fits that. And then we coded to these 6 different criterias, only because we really want to be able to report this in categories. So does it advance diversity? An example of this is that, we do a federally required affirmative action report, and we have a consultant to come in to do that. It helps us advance diversity. Supplier diversity is about our women and minority businesses spending, and then removing systemic barriers. Like, does this spending specifically removes spending barriers, engagement of communities, community investment, and environmental justice. Next slide, please. All right, so I'm not going to go over this really because you'll have these slides later. But really, we talk about this tool, again, the not very creative name of ESAP for this tool, that really increases accountability and transparency and speaks to our commitment to equity. But that, again, we repeatedly talk about our work as an innovation. All of what you've heard today from our speakers are still very, very new in this field and innovative. And I see it as a process that continues to unfold and evolve. Next slide, please. I'm almost done. Okay, so this is just a snapshot. It's an actual screenshot of the Excel spreadsheet that each division is submitting, and you see some examples here of people saying we've made community investment and how we've gone about coding it and fitting it into the 3 definitions, and then doing the last 5 years audit. All right, and we've actually, we are using the last 4 years audit, I keep saying 5, I'm sorry, I mean 4, as a baseline to look forward, because again, of course, people who hear about this work often say, well, what should your equity spending be? We don't know. What should it be? There is really not a lot of precedence for this work. So I think we want internally for us to use the last 4 years as a baseline and to look specifically at those categories that I just mentioned. So our commissioners are showing a lot of interest in community engagement and systemic barriers, for example, and for us to sort of really go to that level of detail and then be able to say, we want to increase community investments by, let's say, 2% in the next few years. We're just looking at those decisions for the next couple of years right now. All right, next slide, please. And I think I'm almost done. All right, so very quickly, as we looked at the last 4 years, you see the first kind of bolded line here, equity spending versus operational spending. Also, by the way, we pulled all of our capital spending out. So, for example, building all gender restrooms at the airports, we pulled out the capital spending and only focused on operating. Why? Again, there is not a lot of precedence for this work. So we've made decisions as we've gone, because capital spending, it's so varies so dramatically from year to year for the airport and cruise terminals. So we focused on operational. And these are the percentage of our equity spending versus the entire operational spending. And then here, down below, you can see of the tax dollars that residents of King County give us, how much of it is going towards our equity spending. And these are the dollars, because I really want us to be able to report that out. And you see, you might wonder why in 2020 it was 40%. And in 2021, and then, kind of half of that, because in those 2 years, we invested a lot of that money by my office advocating for us to work on the number of people who were out of work as a result of pandemic and the economic crisis that faced our communities. We put a lot of money in work training programs and job placements. Next slide, please. This sort of tells you the same thing. And all of this is going on the Port website today for the first time, which is a huge, huge achievement for us. Next slide, please. Just because we work for an organization that hasn't done this level of transparency in the past. This is how it will look on our website. To look at, total operating expenses. This is in millions, and the percentage of equity spending. And then on the right hand, you see the percentage within those of the categories that we want to be able to report on. Next slide, please. And this dashboard, again, is going on our website today. And we are offering tutorials through Tableau, to internally, and to all of our finance team. It's incredible that after 3 years of this work, our finance team have become experts in racial equity and equity tools around the country. And next slide, and I think this might be, all right, just real quickly. At the division level, people are also answering these 4 questions. I'm not going to go over it. But in addition to kind of doing their equity spending, they are asked to address these questions in their team so that there's still a level of reflection and engagement. And next slide. Here's where you see the actual 6 questions that we've used in the last 3 years. And this is kind of what we mean by the equity toolkit that we had prior to actually adding equity spending in. As you can see, this is kind of narrow, and our intention was to go broader. And I think this is the end. Next slide, please. And thank you for this opportunity to be with all of you. I'm really happy to share this and happy to answer any questions. Thank you, Dawn.
Thank you, Bukta. So first, I think there's several comments coming in, just how incredible this is and the work that you're doing, especially on the budgeting side, because budgets are such a critical policy tool, and what you value, your money speaks to what you value, right? So if you show the things that matter to you in your organization in that way. And so, yeah, a lot of great comments coming in. Thank you for that. And so just as a reminder, we have about 15 to 20 minutes for Q&A. Please use the Q&A function to submit questions. We have some lines up already. And I actually want to build, Bukta, on something that you mentioned, which is the word accountability. So we have a couple of questions in the Q&A related to how to ensure that there is accountability in equity work and you hold people accountable to these tools. And this can go to anyone. So I can go around and just see if you want, just come off mute and answer. But Bukta, I'll start with you, and then we'll go to other panelists.
Yeah, I think for us, because we're a governmental entity, I continue to connect the dots between why should government do racial equity work, and because a lot of our employees who are still not bought in, I often say that, and I say it's because government is responsible for much of inequities in our communities. And so we have to tackle the inequities and come forward and be transparent and accountable. And we're lucky that the commissioners who've most recently been elected are really committed to this work and our accountability as much as possible. I'm using organizing on the outside to press our leadership for this, and releasing information. Like, for example, we have our own police department. We passed a policy now that use of force data should be publicly available and on our website. So that's just one example of accountability, that we have to share the data that we have with our community, and that as a governmental entity, that is absolutely a responsibility.
I just want to jump in to add and build on that answer. One, it's government is accountable because it's played a role, but also if we're going to address these system-wide issues, then we need somebody who has the power and ability to be able to address those. So we can't do it on our own as individuals. And that's the shift that we're trying to make, and I think governments are trying to make with the social determinants of health, is that you can't address obesity just by educating one individual at a time. It has to be systemic and structural changes, which the government is responsible for, particularly when we think about local jurisdictions being responsible for public health and the population's health and well-being. So that's why it's important for the government to do it, but also going back to this requirement under the Constitution and most states' constitutions, which says that you are supposed to treat your citizens equally. And so part of the government's role is actually trying to evaluate whether that is happening, not just by passing laws, but seeing the real impact of the laws, practices, and policies to ensure that that actually is happening. So.
And I just want to say, sort of on a micro level, a little bit lower level, although I think Bukta, you spoke to this, is that when we ask our jurisdictions or require them to do something, we also need to provide them with the tools and support that they can do it. So I hear, Bukta, in your work, it took a couple of years to get your financial people up to speed on this. It took us a lot of staff input to get people to, or a lot of support to get local public health departments to do a health equity data analysis. So a top-down just saying do this with no support does not work. You really need to bring people along. And then the other strategy book that you mentioned that I think is really important is the inside-outside strategy. It's not enough for us to want to do it internal to government, and it's not enough for advocates on the outside to be pressing us to do things. It's a partnership between the internal and external forces that I think will help move things along. That's a whole nother topic, but I think it's really important to know just being a well-meaning person within an institution is not going to create the change. You really need that outside pressure.
I would add, I appreciate that these are all such great ideas, and I want to add to kind of what Rukai was saying about what's required under state constitutions, and also say there are also requirements in whatever law or policy established in office or program. So sometimes those will be requirements around reporting or requirements around public transparency that are really important, and so those are can be enforcement mechanisms. And the other thing I would add is thinking really strategically about the role of advisory boards with community power sharing. So one way to ensure accountability is not just to have community advisory boards, but to actually have community advisory boards where community members can actually shape decisions. And that can also be a mechanism for holding organizations accountable. And so the next question builds on this concept, which is around operationalizing the use of racial equity tools. And so the question in the Q&A is, how do you operationalize these tools in the face of organizational leadership that can seem reluctant to change the status quo of operations? Who would like to go to that first?
It is important to have, so the way I look at this, because I didn't work in government my whole career, is to look at the leadership and see where the opportunities are and to exploit those opportunities. Now, we've had very good fortune in Minnesota to have 3 consecutive commissioners who are really in support of advancing equity and racial equity. At the local level, because I noticed a question about how do you work at a local, how do you work where there's resistance to these ideas? Our locals did not always have the support of their local commissioners. So because we were a state agency and giving them lots of money, we made it a requirement that helped it move forward. But so those are just some thoughts.
Go ahead, Bukta.
Oh, sorry. Yeah, is it okay? So I think this is a really good question, and both the commitment from the top, but also the commitment from our frontline staff. To me, to really get a lot of employees engaged who want and are committed to this work has been so important. And that impacts the top, it's just like super connected. And in terms of how do we operationalize it is, and I would say almost 100% buy-in and support at the top for this work. Still, the resistance, and I call it resistance, comes in different forms, because sometimes it's about, we're doing so much, the work is overwhelming, we're understaffed, people are leaving, this is too much to add on. And so it's not necessarily like, oh, this anti-racism work is not great, let's stop it. But it is kind of comes in all kinds of forms of, like, when people get really busy, racial equity work becomes the extra thing that I think people want to cut back. And so I really look for opportunities to get this across as much as possible, that equity needs to be at the center of everything we do. And in terms of tools and operationalizing it, just as I said, because we're trying to do transformational work and not just transactional work, we are trying to make sure that a few tools are getting across and people are implementing it before adding on more. And so for us right now, every team is required by policy, right, to set annual equity goals. 2, everyone in the organization has to have an equity goal in their performance. And supervisors are required to do that for themselves and also for their employees. And then 3 is the entire interviewing and application process to the organization has been transformed. So practicing that. And then 4 is the budgeting. Like, we're really trying to get this operationalized in the organization, I think, before we do more, because it's a lot for people to get it and to practice it.
I would just build on that, and this is based on discussions with the jurisdictions that I mentioned, is that I think it's also talking about investing in things that potentially could work and divesting from things that don't. And so part of this discussion is about doing things that could work, because what we're doing right now is not working. And so a review of this anti-racist work, of all work, right, trying to get to equity, is an evaluation of the things that we are currently doing that's not working, that's taking up so much of our time away from the things that potentially could work. And the last thing I will say is that building relationships with community takes time. It takes a lot of time, but the benefit that you get from that outweighs the time. And so getting people to buy into that is key, because we can just think about so many things that have happened. COVID-19, so many emergency situations, so many situations where if you have a relationship with community, then it's easier for you to move forward in improving the health of that community, instead of always being burdened or feel like you have to rush when the next emergency comes, and then, oh, we have to rush to build that relationship. So,
And I think we have historical examples of that in public health that are really good to lean on. I mean, all the tobacco policy, I mean, maybe it wasn't about racial equity as much, but the tobacco policy and how that started out locally, or the response to HIV/AIDS and how it took that community really demanding action on the part of government. So, you know, we actually have in our history times that this has actually happened and improved health.
So to build, so first I want to note, I did see the request that came in to take down the slide screen. We are working on that. And I wanted to build on this last point that Jeanette was just making, which is, you know, are there any kind of ROI studies that can be cited that help support funding to implement the use of racial equity tools in organizations? And I know that can be a challenging question to answer. So who would like to tackle that first?
I'm going to jump in as a person who has, I think they're saying an R01 study of this work. So I want to jump in and just say, as a person who is a PI on an R1 study, that should not be the thing that supports us doing this work. When we talk about structural racism and the need to address racial equity, most of the funders are just now taking that into consideration in terms of the funding. So you're not going to have research out there, because most of that funding, particularly from NIH, just happened in 2000, 2001. So you're not going to have that. What you are going to have, though, is case studies from cities, counties, local jurisdictions doing this work. I know that the people on here are exemplifiers of the work. Seattle, as you mentioned, King County, there are lots of groups that had started this work back in the 90s. And so to me, that is the support that you need. We at the Institute for Healing, Justice, and Equity were one of the groups that tried to begin to start to study this work. But it really is and should be a grassroots movement of support between governments and local jurisdictions to do this work. And so I know with this presentation, you have 2 jurisdictions that are doing this. You have sites to reports in the chat. And there are wonderful groups that are doing this work to bring it to the forefront. Policy Link, the Governmental Alliance on Racial Equity, so many groups. But I don't want us to get caught up in the thought that we need an R1 study, as if that is the gold star in terms of using racial equity tools or addressing structural racism. Because again, structural racism and these issues were not really valued as root causes. That's just happening. So you're going to have to wait for the studies, but don't start the work and use the jurisdictions that have been doing it and showing great improvement in terms of the health of all their citizens, not just racial and ethnic minorities.
I want to hop in here and say thank you. I think that's a great point, and I often forget about, for those folks who are researchers, R01 studies. I immediately went to what Masood wrote in the Q&A, which is return on investment, because, but they're both relevant, right? And when I worked in the health department, we actually were part of the Results First initiative, which was a kind of return on investment or really cost benefits analysis to public health interventions. they were applying it to public health at the time that I was in the health department. So this was, maybe 5 or 6 years ago. But I believe that repository of resources and studies is still available. But I will say that, one lesson learned from that is the challenge of trying to calculate an ROI or cost benefit for public health, especially because we know that population level changes take so much time to materialize. And that we use a lot of proxy measures. So that I think continues to be a challenge. I want to recognize the time. We have just a few minutes. Any closing thoughts on the challenges? We have a couple of questions related to challenges about talking about this with people who are resistant to talking about racial equity or doing anti-racism work. And we'll wrap it up here. If we did not get to your question, please feel free to reach out and email us. If there's a resource or something we can provide, we'll be happy to do that. Closing thoughts.
How to get the buy-in of people who are resistant. Real quickly, I believe, for me, I would say our office's theory of change is about building as strong of a cohort of people who are supportive of this work as possible first. So if I can increase that number every year by a certain percentage, by more individuals who are coming together and really believe that the rising tide will lift all boats. If people just buy into that theory and buy into why they need to support each other and they are committed to this work and increasing that number, I want to keep my eye on that, as opposed to the people who are resistant and are not interested in the work, because that is more of, I think, a transformational model for the work. Thank you.
Another approach to this is to really lift up the both and. So we have a lot of resistance from folks from rural Minnesota because many of those counties are 98% white. And yet, so it's about rural health inequities and racial inequities. And I pointed out to somebody in one of these counties that was very white. I said, your county is white, but you're part of a region that has a lot of meat packing plants and a major medical destination. There are many people of color in your region. And you know what? They don't go up to a county border and stop. You're responsible for everyone in your area, not just the people in your county. And that was sort of a aha. So I think other ways that we can frame this to invite people into the solutions is really good.
So we have 1
I'll
minute.
just,
Go ahead.
forgive me. I'll just
wrap us
add
up.
on to what Jeanette mentioned earlier, which is looking for opportunities, which Bukta spoke to, in finding your cohorts, which Jeanette mentioned in the and or both and. This is being on the lookout for those opportunities so that we can continue to build what, as Bukta said, we don't have a lot of precedence on yet.
Rukaya, any last thoughts?
I'm just say that this work could be daunting and tiring because we do tend to find resistance. But if we work together as a collaborative, support each other, I think that we have the potential to make great change. And so I'm honored to be here and looking forward to working people to address these issues.
Yeah, I want to thank everyone, Phyllis, Jeanette, Bukta, Rukaya, Daniel. Thank you so much for this great webinar today. We really want to help people to do this work and to support anti-racism and public health practice. So I think this is a start of a great conversation. We hope that you'll take some of these resources. Again, reach out to us. If we didn't get to your question and you have something that we can hook you up with, we will do that. Daniel, has any closing remarks for us?
Yeah, so thank you everyone for your participation in today's webinar. You'll be receiving an email in about a week after this webinar with the full recording of this, as well as the materials. So be on the lookout for that, as well as we will have a survey going out immediately after this webinar to you directly. And in that same email with the materials, please fill that out. It really helps us to get some great data and what we can focus on more for these future webinars. But with that, I just want to thank you all again and wish you a good day. Thanks, everyone.